Hello, Assalamualaikum, and a very good day to everyone. Welcome to week 4 of GFK0026 Assistive and Rehabilitation Technology. I am Dr. Afiqah from Faculty of Engineering, Department of Biomedical Engineering. And today we are going to talk about something that I find really exciting, which is robotic assisted therapy. Okay, you guys have probably seen videos of people using robotic arms or walking machine to recover after an accident or stroke, but have you ever thought about how this robot actually help the body to relearn the movement? Okay, or what kind of engineering goes into this designing this machine? So that is why we are going to explore this topic today. So whether you are from engineering, medicine, or any other field, I will invite you to think like both a scientist and human being, because what we'll discuss today is not just about technology, it is about how we can use innovation to give people hope, strength, and also independence again. Before we dive into the main content, let's look at what we will be learning today. By the end of this lecture, you should be able to first explain what robotic assisted therapy actually means, what it does and how it helps, and why it is used in rehabilitation. And then secondly, you should be able to identify the key types of rehabilitation robot. For example, robot that can help people to walk again, robots that can help people to regain arm or hand movement. And then third, you understand the basic engineering principle behind how these robots work. We will look at things like control system, sensors, and how this machine actually interact with human being or human body safely. And lastly, I want you to start thinking critically, not just how these robots are made, but why they are made. Okay, think about accessibility, cost, and how we can make this technology available for everyone. So not just in hospital, but maybe one day at home too. So this topic is really interesting because it's connect the topic of engineering, medicine, and human empathy all in one. So even if you are not from biomedical engineering, you will still see how this technology can directly change lives. So now let's start with a simple, powerful question. Can a robot really help someone to walk again? It sounds like something from science fiction movie, right? But it is actually happening right now. Now let's start with a simple but powerful question. Can a robot really help someone to walk again? So it is sound like something from science fiction movie, but it is actually happening right now in hospital and also research lab, rehab center, and all around the world. Imagine this. A person who had a stroke and can no longer move their legs properly. And with months of therapy, progress can be slow and very painful, but when we bring in robotic technology like exoskeleton, you will see the picture later, or robotic treadmill, suddenly they can start moving again much earlier. So this robot don't just move the body, they actually help retrain the brain. So every time the robot helps a patient to take a step, the brain receives the signals and like a reminder that says, this is how walking feels. So over the time, the brain relearns how to control the movement. So yes, robots, they can help people to walk again, but the real story goes deeper. It is about people, engineers, doctor, the patient, and all working together to rebuild hope one step at a time. So in the next slide, you will get to watch, actually in Spectrum, I've put the link in Spectrum, a short tech talk by Dr. Michelle Johnson, who is doing exactly this kind of work. So she combined biomedical engineering and human compassion to make a robotic therapy more accessible for everyone. I want you to first listen to her video and then can continue with this lecture video. Okay, and then with that you can explore this topic a little bit deeper. So I want you to watch the full video carefully. Do not skip through it, and please don't use AI to write your reflection. I am more interested in your thought or how you personally feel about what she shares. And after watching, you will take part in the forum discussion on Spectrum. This will be part of your week 4 activity. The submission deadline is on 16th of November. Okay, here's what you need to do. Go to Spectrum, scroll down to week 4 forum. What inspired you from Dr. Michelle Johnson talk, and then you need to watch the TEDx video link provided in Spectrum. Make sure you watch the entire talk from start to finish, then answer the question in your own word. Okay, what part of Dr. Michelle Johnson's story or message did you find most memorable or emotionally moving, and explain why. And do not summarize the whole talk. I just want to know what you personally found inspiring or meaningful in her talk. And finally, you can choose one of the your friend comments and then reply to at least one of your classmate posts. Okay, keep your tone friendly and respectful. This is a place or the space to share ideas, not to be right or wrong. So be honest, be creative, and most importantly, show your own perspective. All right. The goal of this activity is not just to test your understanding, it is to make you think like an engineer and human being. How can we use technology, empathy, and design to come together to change someone's life? Okay, now, you have seen how inspiring this field can be. Okay, let's understand what is robotic assisted therapy actually means. So in simple word, robotic assisted therapy is a type of rehabilitation that uses robots to help people move, exercise, or relearn body movement after an injury or illness. Okay, these robots are not just replacing the therapists that we have in the hospital, they are actually helping these therapists. Okay, the robot can guide a patient's arm, leg, or hand to move in a safe and controlled way. While doing this, it gives feedback to both the patient and also the therapist. Okay, things like how strong the movement is, how smooth it was, and how much progress the person is making. Okay, robotic assisted therapy is often used for people who have an stroke, spinal cord injury, brain injury, or other movement disability. And of course, the main goal is to help patients to regain their independence, to be able to walk, reach, or hold things again after the disability that they have. Okay, you can think of it as a partnership between humans and machine. The robot provide the consistency and precision, while the therapist and patient bring the motivation to human touch. So robotic therapy is not just about movement, it is about helping people to rebuild their confidence and also the quality of life. Okay, so why robots in rehabilitation? So why do we even need robots in rehabilitation? Let's think about traditional therapy first, okay? A physiotherapist usually help a patient to move their arm or leg again and again. Maybe happen to your family members, your grandmother or your parents. This usually a normal conduct in Malaysia and most of the country. A physiotherapist will usually help a patient to move their limbs again and again, maybe hundreds of times a day. This is a repetitive. This repetitive movement is very important because the brain needs to relearn how to control the muscles again. But for many patients, especially those recovering from stroke or severe injury, this therapy can take months or even years. And therapists, they get tired. Patient, of course, they will get tired because they need to go back and forth to the hospital. or rehab center, and sometimes the progress is very slow, like especially when the motivation going down. Okay, and then what the robot can do is provide the consistency. A robot can repeat the same movement accurately every single time without getting tired or distracted. Okay, because we program it, and with this it can help the patient to train longer and also more effectively. The second one is precise control. The robot can adjust how much force it gives. We can control it. We can give an input of how much force, how fast it can be, how much assistance the patient needs. Okay, so for example, if the patient start to recover from some strain, the robot can slowly reduce its help. This encourages natural movement and also independent. And then why robots can measure exactly, can give real-time feedback. Robots can measure how the patient is performing accurately, things like joint angle, speed, muscle effort, and this data can help the therapist understand whether the patient is improving or not, or struggling or compensating with the wrong muscle, which is very important in this therapy. And then why robots in rehabilitation again. For motivational and engagement, many robot systems are now designed with games and virtual reality. So patient can play while doing this therapy, like catching a virtual fish or walking through a digital part, or moving a robot arm to hit the target. So this keep the session fun and help patient to stay motivated. And then the last one is robotic rehabilitation. Robots in rehabilitation, portable and can even be used at home. So this makes the therapy more accessible, especially for people who live far from hospital, or in any cases that the patient has a mobility challenges and cause them some difficulties in order to go to the hospital. So when we talk about robotic assisted rehabilitation, we are really talking about the future of therapy, one that combines human care and engineering innovation to help people recover better and faster. Alright, now let us go to the next slide. How does robotic assisted therapy work? Now that we know why robots are used, okay, let's look at how robotic assisted therapy actually works. Okay, the main idea is very simple. The robot, they help the patient to perform physical movement again and again repetitively, while collecting information about how their body is actually responds. You can think of as a closed loop system between the patient and also robot and also the therapist. Okay, let's break it down into steps. Okay, so the first step is step 1, the patient. The patient is fit with the robotic device, as you can see in the picture in the slide. This could be an exoskeleton that support an arm or leg, or a robotic end effector that moves part of the limb. The patient try to move as much as possible, even if it is just a small effort. Okay, the step number 2, which is the sensor. Okay, the robot the robot has many sensors. This measure how much force the patient uses, how far they move, and the direction of the motion. Some system even record muscle activity or brain signal. And then step number 3 is the robot response. Based on what the sensor detect, the robot gives the right amount of help or resistance. For example, if the patient is too weak, the robot assists them to complete the motion. And if the patient is stronger, the robot may give resistance to challenge their muscle. And then we have step number 4, the feedback, which the robot sends the real-time feedback to both the patient and also therapist through numbers, graph, or even games. Okay, with this, this can help track progress and keep patient motivated. And then we have step number 5, adaptation and learning over the time. The system learns from the patient performance. Now we have AI. Some advanced robots use AI or adaptive control algorithm to adjust the therapy difficulty automatically, meaning that we don't need to really adjust the parameter use, the variable used in the machine, but AI can help to adjust the therapy difficulty automatically. This way, the therapy becomes more personalized and also the patient can improve faster. So basically, robot-assisted therapy is a smart system that combines motion, sensing, control, feedback, all to help the body and brain reconnect. Okay, it is not like magic. It is just engineering working together with neuroscience to help people to move again. Okay, now let's talk about the two types of rehabilitation system based on how they move and assist the body, based on mechanism basically. So these are the N-effector robots, N-effector based system, and then exoskeleton robot or exoskeleton based system. Let's start with the first one. Okay, N-effector based system. In this system, the robot connects to the patient at just one point, usually the hand or the foot. If you can see from the picture, MIT Madness. Okay, the robot connects to the patient at just one point. Okay, imagine a robotic hand or a pedal that moves the limb in specific pattern. When the robot moves that single contact point, the rest of the limb follow it naturally. Just like how your hand moves when you pull a rope. Okay, try to imagine. So, these systems are simpler in design and are easier to set up. They allow more natural motion because the joints are not physically restricted. And some good example, like I mentioned in the table, MIT Madness in the picture. You can also see on YouTube how it's actually work. And we have the machine used for upper limb rehabilitation. For the lower limb, we have Locomat gait trainer, which can move the legs through robotic foot plates. And however, the challenge with an effector system is that they cannot be perfectly control each joint separately. They move the limb as a whole unit. Now let's talk about the second type, which is exoskeleton based system. So these robots are designed to look and move like human skeleton. They have joints, they have links and actuator that match the body anatomy. If you can see from the picture of the rewalk here, the exoskeleton is strapped directly to the patient limbs. So when it moves, each of the patient joint, like shoulder, elbow, hip, knee, they will move together with it. So this design gives very precise control movement. It is especially useful for retraining complex patterns such as, of course, walking and also grasping an object. However, exoskeleton, they are usually more expensive compared to the N-effector robot. Okay, they are heavier and they need more adjustment for different body size. So in summary, N-effector robot, they are simpler, flexible, can control overall limb movement naturally. And exoskeleton robot, they are a bit complex but precise, they can control each joint individually, but both are useful. The choice will be depend on the patient condition, therapy goal, and also the available resources. So you can think of it like this. The end effector robots, they will guide the movement from outside, okay, while exoskeleton robot, they mirror the body from within, okay. So end effector robot from outside, exoskeleton from within. Now let's look at another way we can classify a robotic rehabilitation system. This time based on which part of the body of the robot helps. Okay. Now we have upper limb robots, lower limb rehab robot, and I forgot to put in the slide, we also have hand and finger rehabilitation robots. Okay. Now let's go through each of this category of the robot based on the body parts. First, upper limb rehabilitation robots. This robot, of course, they will focus on the upper body, which are shoulder, elbow, wrist, and they are mainly used for a stroke patient who have a weakness or paralysis in one of their arm. A stroke patient, usually they will have difficulty in either side of the body, and the goal is to help to restore daily activities like reaching and lifting or even eating. Okay, some common examples, if you can see from the table, we have MIT Manners. You can Google the picture. One of the first robotic rehab system for the arm training, and then we have Armio Spring. This is a very we have this at Pekeso, Pusat Rehabilitasi Pekeso Melaka, and most rehab hospital they have this Armio Spring, which support the whole arm and provide interactive games to motivate patient. Okay, and then we have in motion arm robot. This also help patient to perform repetitive reaching tasks while recording their progress. So this robot, they help the brain and arm reconnect through repetitive motion and also feedback. And the second one, we have the lower limb. Of course, it is designed for the hip, knee, and also ankle. They are used mostly for people who have lost walking ability due to stroke, spinal cord injury, or neurological disorder. And then the example include, you can see from the picture, we have Locomat, which is a robotic gait trainer that help patient walk on the treadmill while being supported by harness. And then we have Rewalk from Israel. And then we have this robot. 1 minute. We have Exobionic. Okay, is a exoskeleton that allow people with paralysis to stand and walk again. And then we have the third one, which is hand and finger rehabilitation robots. These are usually most of them coming from China. Most of them are smaller, highly precise device that help patients to regain fine motor control, for example, grasping, pinching, or typing. And the example include the Hand of Hope. This one is from, I think, Hong Kong. And then we have Armadillo hand robot. They are often combined with games like virtual tasks, like picking up virtual object, or playing piano keys, just to make the exercise fun and meaningful. So in short, upper limb robot focus on arm movement, lower limb robot restore walking, and hand and finger robots, they rebuild fine control and grip. Okay, and together this system, they cover almost every major movement in the human rehabilitation, from walking to holding a cup of tea again. Okay, now we have types of robotic rehabilitation system based on the assistant level. We can also classify the robot based on this concept, based on the level of assistance. Okay, in other words, how much help does the robot give during the movement? Okay, there are three main categories here, which are passive therapy, active assisted therapy, and active or resistive therapy. So let's go through them one by one. So first, the passive therapy. In this mode, the robot completely moves the patient's limb for them. The patient doesn't need to put any effort, and this is usually used in the early stages of recovery. For example, right after stroke or surgery, when the patient's muscles are too weak to move on their own. And the goal here is to keep the joints flexible, prevent stiffness, and also stimulate the brain with movement patterns. You can think of it like the robot teaching the brain what normal movement feels like again. And then the next one, we have the active assisted therapy. So in this mode, the patient tries to move. Patient tries to move, and the robot helps only when needed. For example, if the patient can lift their arm halfway, the robot will support the rest of the movement. And this mode encourage patient to participate actively while still getting enough support to complete the task. And the robot uses sensors to detect the patient effort, then give just the right amount of help, and not too much and not too little. And finally, active or resistive therapy. So this is for patients who have already regained some strength and also control, and here the robot doesn't help, instead it provides resistance. Doesn't help, but giving resistance to the patient. The goal is to build muscle strength, and it is like an exercising in the gym, but resistance is precisely controlled by the robot. Some system even turn this into games. The patient must push harder to move a virtual object or win a challenge or anything like games. So in summary, passive therapy, the robot does all the work. Active assisted therapy, robot and patient share the work together. And active or resistive therapy, patient does the work and robot gives the challenge. So as the patient recover, they usually move from passive, assisted, and also active therapy. And then you see the beauty of the robotic system is that they can smoothly adjust this level of help. So therapy always matches the patient ability. So now that we have understand what robotic assisted therapy is and how it works, let's talk now about the benefits. Why are so many rehabilitation centers around the world starting to use this all robotic system? First and most importantly, consistency and also repetition. Robot can repeat the same movement over and over again with perfect accuracy and also timing. In rehabilitation, repetition is the key. The more you practice, meaning the more you practice a movement, meaning that you have your brain and muscle learn it more from the exercise. For example, a robot can help a stroke patient perform hundreds of walking steps in one session, something that would be very tiring for a therapist to do it manually all day long. And then secondly, it is a measurable progress. Robotic system, they can collect data during every session, joint angles, force applied, speed, and even muscle activity. So this data really help the therapist monitor the progress of the patient objectively, not just by observation, but through an actual data, numbers, and graph. And also it helps to motivate the patient because they can see the improvement on the screen. And the third one, motivation through gamification. Of course, many robotic systems come with game-like interfaces. A patient might move a virtual arm to catch falling objects or walk through a simulated environment, and this makes therapy more fun and engaging, especially for long rehabilitation sessions that could otherwise be very boring. And then we have a personalization where robot can automatically adjust. Now we have AI, like I mentioned just now, adjust the difficulty level based on each patient ability. For example, if the patient gets stronger, the robot can give less help for increase the resistance, in the previous slide. Okay, that way every patient receives their therapy just right for their stage of recovery. Now, even though robotic therapy sounds amazing, it is not without challenges. Let's now talk honestly about some of the main issues faced today. First one is, of course, the cost, very high cost. Robotic rehabilitation system can be very expensive, sometimes costing hundreds or thousands of ringgit, and this makes it difficult for a smaller clinics or rehab center hospital to afford them, especially in developing countries. Okay. Second, the limited accessibility because of the cost and the need for specialized training. Not every patient can access the robotic therapy. In some rural areas, they might not have such system at all. And then we have technical complexity. This robot, they require maintenance, of course, calibration, and also update. And if something goes wrong, for example, a sensor malfunction or anything, therapy might need to stop until the machine get fixed. So this means engineers and therapists, they must work closely together to ensure smooth operation of using this robotic therapy. And the fourth one, lack of human touch. Even though robots are precise, but they cannot replace the emotional support and encouragement given by the human therapists. We should agree with this. And some patients, they feel more motivated with personal human interaction, not just a machine. And the last one, data and safety concern, where since the system collects a lot of data, there's always a concern about the privacy and how this data is stored. And of course, safety is very critical. The robots must respond correctly if the patient experiences pain or fatigue. So while robotic therapy, they offer huge benefit, so these challenges remind us that it's not one size fits all solution. The goal of engineers and clinicians is to balance both sides to make this system more affordable, safer, and also easier to use while keeping the human element of care. Okay, now let's look at a real example of how robots are helping people walk again. The Locomat. Okay, we can play the video. You can play the video. I just want to explain here. This Locomat is a special kind of robotic walking machine. They are used in hospital and rehabilitation center. You can imagine a person who had a stroke or spinal cord injury. They might lose their ability to walk. In traditional therapy, usually 2 or 3 physiotherapists, they need to help the patient to move their legs again and again. But with Locomat, a robot will help to do this job safely and also consistently. And then the patient wears the robotic frame on their legs, hip, and this frame is connected to this treadmill. And there's also a support harness that lifts some of the body weight so the patient doesn't fall or get tired too fast. Then as the treadmill moves, the robot gently moves the person's leg in natural walking motion, left, right, just like a real walking. So it sounds simple, but it is very powerful because it can help the brain to relearn how to control their legs again. And the Locomat also has some sensor that record the patient movement and also progress. And the coolest part is that patient can see their movement on the screen in front of them, like they are walking through a park or city. It makes the therapy more fun and keeps them motivated along the journey. So instead of lying in the bed doing small exercises, they get to walk again with the help of the robot. And this is not replacing physiotherapies. This therapist is still there just to guide and also adjust the training. And the robot just makes the work easier, safer, more precise. In short, this Locomat help people to walk again, train longer, and recover faster using the power of robotics and also the smart technology. And then we have HAL, the hybrid assisted limb, Cyberdyne Japan. So now this is the next device that really sound like something from science fiction movie. Okay, but it's completely real. It's real. It is called, like I mentioned just now, HAL. HAL was developed in Japan by a company called Cyberdyne, and is one of the world's first robotic exoskeleton that can actually read the user's muscle signal. You can go to YouTube and you can watch this video. And if you want to learn more, can go to YouTube and find the information or the video related to this HAL. So how does it work? When you want to move your leg or arm, your brain will send tiny electrical signal through your nerves to your muscle. So if your muscle are weak or cannot move fully after an injury, this HAL can detect those tiny signals from skin using special sensors, and then the robot understand what you want to do. For example, take a step, or it help you to move your leg in any direction that your brain is thinking. It's like a robot reading your mind through your muscle. Okay. Because of that, this HAL is called a hybrid system, which is a part human control, part robotic support. Now let's imagine a person who had a stroke or spinal injury and lost their ability to walk. When they wear this HAL, they can slowly start to walk again, step by step, and as they are keep and when they wear this HAL exoskeleton, they can slowly start to walk again, step by step. As they keep practicing, their brain and muscle, they will start to reconnect, and over the time, the robots can help can reduce, and the person can begin to move naturally on their own. This HAL they are also used in elderly care, industrial setting, and even for workers who need extra strength to lift heavy things safely. So what makes this HAL so amazing is how it blends neuroscience, robotics, and human recovery together. It doesn't just move the body, it helps the brain to remember how to move, and there's a big difference compared to robots that simply carry or move patient passively. So HAL, they help people to regain control like their own movements. It's like giving them a second chance of independence. Now we have Hokoma. We have talked about robot that help people walk. Now let's look at one of the robotic rehab that can help people use their arm or hand again. So this one we call it as our Mio Spring, and then it was developed by a company called Hokoma. It's a very famous brand in robotic rehab in Switzerland. So the same company that makes the Locomat, we saw it earlier. Okay, the same company, and the Mio Spring is used for people who have lost strength or control in their arm. They are often after stroke, brain injury, and also spinal injury. So the patient places their arm into this mechanical arm. This mechanical arm with support, and then that's connected to a computer. So the system has a spring that makes them feel lighter. So it is easier to move even for someone who is very weak. That's where the name Mio Spring comes from. The spring support the arm movement. But here is what makes it interesting. When patients use this Mio Spring, they don't just move their arm up and down. They play interactive games or complete a virtual task on the screen. For example, from the video you can see that they move their arm to catch virtual butterflies or lift their hand to water a digital plant, and it sounds fun, but it's actually serious therapy because every movement is carefully tracked. So therapists can see how patient improves over time, and then the games keep the patients motivated, and the robot give real-time feedback like showing if the movement was correct or strong and how strong it was. So the key idea is repetition and engagement. In normal therapy, it's very hard to repeat the same arm exercise hundreds of times. It gets boring and then very boring and painful. But with Mio Spring, patient can do it happily because it feels like just playing a game, and this is real. Like the feeling is real. And the research show that when patients are more engaged, their brain learns faster and process called neuroplasticity, which I will explain to you later. This where brain builds the new connection to recover movement. So the Armio Springs is combine engineering, gaming, and also rehabilitation to make therapy both effective and also enjoyable. Okay, to summarize, this Armio Spring, it's support weak arm, use game and virtual reality to make the therapy fun and more motivating. It can help to track progress with sensors and also encourage active participation and repetition. Okay, now we have the last example here, which is in motion arm robot from Bionic Labs in the United States. So this robot has a very interesting history. It's actually started as a research project at MIT. We call it MIT Manners. Okay. Over the years, it's developed into I should show you MIT Manners, but you can Google about MIT Manners, and now we have this is actually the continuation of that project, and over the years it developed into a real medical device used in hospital and over the world. So what is in motion arm robot do? So this machine this robot help people who have difficulty moving their arm. For example, after a stroke, the patient sits comfortably, places their hand on the handle, and the robot gently assists their arm through different movement, like reaching, lifting, drawing shape on the screen. And the robot can sense how much the patient is helping, and it adjusts its supports automatically. And if the patient is weak, the robot will help more. Okay, if the patient gets stronger, the robot lets them to do more of the work, and this makes therapy personalized for each patient, each person, every single time. But here's the really powerful part of the system. The system collects data from every session, how far the arm moves, how smooth the motion is, and how much effort the person puts in. So the therapists can use this data to track improvement over the time and make a decision about the next stage of training. Okay, it is actually just like Armio Spring in motion just now. It's not about the movement, it's also about retraining the brain. Okay, so every repeated movement will help the brain to relearn control over the arm and also the hand. Alright, the science behind robotic therapy, we're rewiring the brain. Now let's talk about the science, like I mentioned just now, neuroplasticity, the science that makes robotic therapy so powerful, something called neuroplasticity. Okay, don't worry, it is if the word sound like big, we can break it down. Neuro means the brain, and plasticity means ability to change or adapt. Plastic. So neuroplasticity simply means the brain ability to recognize itself, to make a new connection and pathway after an injury lah. So imagine your brain is a huge network of roads. So when someone has a stroke or brain injury, some of those roads are damaged or blocked. So the signal cannot reach the muscle like before. Okay, so again, someone has a stroke, some of their blood vessel block, and then the signal cannot reach the muscle because the brain and the muscle, they are connected with the pass the information through a signal. But here is the amazing part: the brain can learn to build new road around the damaged area. So with the right kind of training and repetition, other part of the brain, they can take over and control the lost movement again. So this is exactly where robotic therapy will help. The robot will guide the patient body through repeated correct movement over and over again, and each time the patient practices, the brain will get a message. This is how I move my arm. This is how I take a step. And slowly, new brain connection, they will be formed. So in traditional therapy, it is a bit hard for a human therapist to repeat the same motion hundreds or thousands of times. but the robot, they can do it perfectly and as consistent and very consistently, while also giving us the real-time feedback, the data. So the repetition is what helps the brain to relearn control. The key word here is repetition. And then think of it like learning a new skill. When you first learned to ride a bicycle, if you remember, your brain had to practice balance, steering, and pedaling together. Or if you learn how to swim, at first it was awkward, but with repetition your brain builds a stronger and faster connection, and soon it becomes natural. The same principle applies in rehabilitation. Robotic therapy will give the patient a safe, controlled environment to practice movement again and again, helping the brain to rewire itself. The next slide is the role of therapist versus the robot. Okay. Sometimes when people hear about robots, or usually AI now, in rehabilitation, they start to worry. Does this mean that robot will replace human therapists? A lot of debates on this topic, but the answer is definitely no. Robots are tools that help, and they cannot do everything as like a therapist. Everything a therapist does. Okay, let's think of it this way. The robot, it provides the muscle, and the therapists provide the mind and heart. The robot's main job is to help patients perform movement accurately and repeatedly. But it can track the progress. It can give consistent motion and even adjust the level of support automatically. It is very precise and never get tired, which make it great for repetitive training. But what robot cannot do is to understand the patient emotions, patient motivation, or subtle changes in the behavior. That's where the therapists come in. The therapists observe how the patient is reacting, not just physically, but emotionally too. These therapists, they will encourage to adjust the therapy plan, make decision about when to push harder or when to let the patient rest. And these therapists also interpret the data collected by the robot. The robot can show numbers, for example, how many steps were taken, how much force was used, but the therapists who understand those numbers actually, what numbers are actually means for recovery. So another important role of the therapist is to make therapy personal. Every patient we know is different. They have different goals, they have different limitation, different motivation, and the therapists, they all knows how to adapt the exercise to suit each person. So robots can be programmed, but they still rely on the therapist to set up and guide the session. So you can think of this relationship as a partnership. The robot make therapy more efficient, and the therapist make it meaningful and human. Together, they can help patients recover faster and more safely, and with better long-term results. So without the therapist, the robot would just be a machine moving a limb, but with the therapist, it become a part of thoughtful and caring rehabilitation process. Okay, we are actually near to the end. Now, our last slide, I think. Yes, the future of robotic assisted rehabilitation. Of course, as we look forward, the future of robotic assisted therapy is really exciting. Okay, we are starting to see, of course, AI robots. They are smaller, lighter. We are starting to see robots. They are smaller, lighter, and more wearable. So their therapy could even happen at home. Even my research project is related to the virtual reality that can help the stroke patient or upper limb amputee to gain their independence again using games, virtual reality games. As you can see here, all the VR headset, they are become cheaper now, and it is very exciting for us as a biomedical engineer to see all this technology and how we can use all this technology to help the patient. So, like I said just now, we are starting to see robot become smaller, lighter, and more wearable. So, therapy can even happen at home rather than just in hospital. You can imagine a robot glove or exoskeleton that a patient could put just in their living room and practice exercise while watching their favorite show. Okay, technology is also moving forward. Smart connected systems, future robot could use AI, learn from each patient movement and pattern, adjust therapy automatically, making it even more personalized. And then scientists and engineers are also exploring soft robotics now, and then it is we have now lightweight exosuits which are much more comfortable and easier for patients to use, and this could make robotic therapy available to more people, especially in the area where hospital cannot afford big expensive machine. And then the most important part is the future is not just about technology. The future is not just about technology, it is about combining robots with human care. Therapists, engineers, patients, and families will all work together to make this therapy more effective, accessible, and motivating. So as you think about robotic assisted therapy, don't just imagine the machine. Imagine how this tool can empower people to regain independence, confidence, and quality of life. And that is the real promise of the future. Okay, we come to the end of the lecture today. I hope you will get some insights on what our topic today, robotic assisted therapy, can be used to help a person with disability, or like for example in this case stroke, spinal cord injury patient, or anyone with the motor problem. They can regain their independence again using this robotic assisted therapy. All right, thank you so much. Please complete the forum in Spectrum, and then I think we'll see you again in another topic which is related to virtual reality. Okay, assalamualaikum and a very good day. Thank you.